Polycystic ovary syndrome, PCOS, is a hormonal disorder common among women of reproductive age. Women with PCOS may have infrequent or prolonged menstrual periods or excess male hormone levels. The ovaries may develop numerous small collections of fluid and fail to regularly release eggs. In an exclusive interview with GBN, medical practitioner and family doctor Keisha Lowe simplifies the condition to us.
Yes.
First of all, could you tell us what is this condition?
Yes, ma'am. So polycystic ovarian syndrome is an endocrine disorder. It's a hormonal imbalance disorder of women affecting primarily the reproductive organ called the ovaries. So the ovaries normally produce estrogen and progesterone, but they also produce a little bit of androgen, which is typically called the male hormone because it's more, it's a higher percentage in males. However, in this syndrome, they overproduce androgen. And this is where the problem comes. This is where the imbalance comes and the problems with the menstrual cycle.
The exact cause of polycystic ovary syndrome is unknown. Irregular periods or no periods at all, difficulty getting pregnant, excess hair growth, and oily skin are some of the symptoms related to polycystic ovary syndrome. Dr. Lowe says early diagnosis and treatment, along with weight loss, may reduce the risk of long-term complications such as type 2 diabetes, heart disease, and infertility.
But if this woman is having PCOS, hasn't had a period in a long time, the lining has not been sloughed off. So this lining of the endometrium is continually building up, building up, building up. It becomes hyperplastic. It undergoes hyperplasia. It overdevelops. And this can increase this woman's risk of endometrial cancer. So I think that's the most serious side effect or serious consequence of PCOS, especially if it's not treated, is that you definitely can get endometrial carcinoma.
Dr. Lowe highlighted some of the treatments that can be used for polycystic ovary syndrome.
So weight loss is a real big thing, and it's just not something most people are willing to really focus on. They think it's easy to just take a pill, but that's not necessarily the case. I mean, there are hormonal treatments we do give in terms of birth control pills. There's also something called metformin, which is commonly used more. Everybody knows it as a diabetic drug, but what it does is it increases the body's sensitivity to insulin, so that now helps to decrease the androgen overproduction, which then helps the period to become more regular.
The medical practitioner is encouraging women who has been experiencing issues with their cycle to check their doctors as soon as possible. For GBN News, I am Rena Perry reporting.